All right, in order to take vital signs, you're gonna have to take the blood pressure cup and put it between 1 to 2 fingers above the patient's brachial artery. You want to be able to fit 2 fingers underneath so it can move. Then we're going to be looking at the pressure gauge and using the pressure bulb to pump it up. I found our artery and I started out and I got 100, so I added 30 to that. So I'm going to start and pump it up to 130 in order to get the blood pressure. And I got 100 over 67. So her blood pressure with systolic being 100 and diastolic being 67. Next, I'm gonna do the pulse oximeter on her finger, and that helps me see the saturation of oxygen in her. Next, I'm gonna do the pulse oximeter, and I'm gonna place it on her index finger. She does not have any nail polish on, so it's not gonna show any errors. I press the button, and then I place it on there, and I let it load. It's gonna tell me her oxygen saturation, and then it's gonna tell me her heart rate. And it says that she has a 99% oxygen saturation level and that her heart rate is 76. You're good. Okay, the last 2 vital signs I'm gonna take are the heart rate and the respiratory rate. I'm gonna set a timer for a minute and spend 30 seconds on each and multiply both by 2. Okay, so her heart rate is going to be 74 and her respiratory rate is 16. Okay, in order to take the temperature, I would take the probe out, place the covering on it, make sure it's on the right setting for oral, put it in the posterior sublingual pocket, and it's gonna start loading. And she's at 98.8, which is a really good temperature. Discard the covering and place it back in. Hi there, I'm Kaylee. I'm going to be your nurse today. I just want to kind of fill out this patient health history form for you to kind of get a little bit of knowledge and see why you're in here with us today.
Great.
So can I start off with your name, please?
Ben Amos.
Awesome. And what is your date of birth?
58 years old.
Your height?
5'11".
And your weight?
180.
And sex?
Male.
And what is your current marital status?
I'm not married.
Okay. So you're single?
Yes.
Okay. And how much education have you had?
Bachelor's degree.
Okay. And are you currently working anywhere?
No, retired.
Okay. And where did you work previously?
Factory.
Okay, so lots of loud noises?
Lots.
Okay. And what brings you in here today?
Trouble in my hands and my feet.
Okay.
I've been told it's arthritis. It hurts most in the morning. It gets better after I get moving with my day. By the end of the day, I'm really feeling pain in both my feet and my hands.
Okay, so you're experiencing it in both your feet and both of your hands. All right.
More in my right hand
Okay.
than my left.
All right, and so in the past, have you had any arthritis, cancer, depression, diabetes, epilepsy or seizures, heart problems, heart surgery, high blood pressure, psychiatric disease, stroke, thyroid Feel free to ask me if I need to repeat any of those.
Arthritis and depression, high blood pressure.
Okay. And have you had any previous surgeries?
Nope.
Have you had any serious injuries?
I have not.
Good, that's always good. Okay, and medications. So, are you on any medications currently?
Sertraline.
Okay, and do
Daily.
you take that pill every day?
Yep.
Okay, anything else?
Then Tylenol for my arthritis pain.
How much of that? How many milligrams?
500 to 1,000.
Okay. And do you have any allergies that we should be aware of?
ACE inhibitors.
Okay, and what happens when you take those?
Gives-
Okay. Gives you a cough?
Yeah.
Okay, okay. Great. And do you drink alcohol?
Yeah.
How often?
A lot.
What's a lot?
A couple beers a day.
What's a couple? Like 1 to 2 a day, 2 to 3?
2 to 3 if
Oh.
I'm feeling good.
Okay, okay. Do you smoke?
Nope.
Not even socially?
No.
Okay. Do you consume caffeine? Like
No.
coffee or soda?
Nope.
Do you use any recreational drugs?
No.
Okay. Are you sure?
No.
Are you on a special diet?
No.
Alright. So we're going to kind of talk about your mental health. So are you seeing or have you seen a therapist?
No, I haven't.
Okay. Are you currently experiencing overwhelming sadness, grief, or depression?
Depression.
Okay, and about how long have you been suffering from that?
Since my life passed 10 years ago.
Okay, and alright. I'm very sorry to hear about your loss. Are you currently experiencing any anxiety attacks or panic attacks or have any phobias that we need to be aware of?
No.
Okay. So you are having chronic pain, you said, with the arthritis?
Yes.
Okay, every day?
Yeah.
And how long's that been going on?
5 years now.
Okay, and it's always been in both your hands and your feet? Or did it
Mhm.
start in one area and go to another?
Just both.
Okay. And are you currently in a romantic relationship?
No.
Okay. Have you had any specific life changes or anything that have been really stressful lately going on?
No.
Alright. And so I'm going to ask you about your family history. Is there any conditions that your family has had that we need to be aware about?
My dad had skin cancer.
Okay.
My mom had high blood pressure
Okay.
and a thyroid.
Your mom had the thyroid?
Yeah.
Okay. But you yourself only have struggled from the high blood pressure.
Yes.
Okay. Alright, now I'm gonna keep going. So I'm gonna read you off a few questions and you just let me know if that you're experiencing any of these. So overall, what's your health been? Pretty good? Have you had a recent weight change, loss of appetite, fatigue, fever, chills?
Been feeling pretty good.
Good. And then for your allergies, you just said that you were allergic to the ACE inhibitor, correct?
Correct.
Okay. So about your ears and your mouth and your nose and your throat, have you had any difficulty swallowing or earaches or anything?
Just ringing in the ears.
Okay. And for your eyes, do you have any blind spots, blurred vision, double vision?
I wear glasses.
Okay.
I'm nearsighted.
Okay, and for your gastrointestinal, have you had any issues with your stool or being constipated, nauseous, vomiting?
No.
In your genitourinary, have you had any blood in your urine? Or any of that?
No, on the mouth.
What does that have to do with urine? Okay, ready?
Yeah.
For your genitourinary, have you had any blood in your urine or have any problems with going to the restroom?
Mm-mm.
Okay, good. You haven't been experiencing any urgency with urination, no issues? It's all been good?
Yes.
Good. And for your heart and lungs, you have high blood pressure? Have you had any pain in your chest or high cholesterol or irregular heartbeats or anything?
Mm-mm.
your muscles in your joints? Have you had any back pain, struggle walking, joint pain, stiffness?
Joint pain, my hands and feet, and then joint stiffness.
Also in your hands and feet?
Yes, I haven't noticed any swelling though.
Okay. And for your neurological, just want to have you had any balance issues, droops, headaches, injuries to the eyes, difficulty speaking?
No.
Okay. Are you right-handed or left-handed or both?
Left-handed.
Okay. And you have suffered from depression?
Yes.
And you're on that Sertraline.
Correct.
And have you had any pulmonary issues like a blood in your cough, cancer?
No.
For your skin, have you had any rashes, sun sensitivity, or itching?
No.
And for your sleep, do you have snoring, sleepwalking, or nightmares?
No.
Do you sleep well?
Yes.
Do you feel rested when you wake up?
Yes, I do.
And do you fall asleep at all during the day?
Nope.
All right, that was pretty much this. I'm going to get this put in the system for you, and then I'll get back and we can kind of check your vitals and everything. Thank you.
Thank you.
Okay, so when you interview your client, when you come into the room and you want to do that patient, hand hygiene still applies now more than ever. So you're still going to want to do it before you have patient contact, before an aseptic task, after bodily fluid exposure, after patient contact, and after contact with patient surroundings, such as like their bedside table or any of that. And it's important to know that you can use hand sanitizer majority of the times, except it's suggested that you use warm water and soap for at least 15 seconds while getting in all your grooves and removing your jewelry before you enter the room. But if your hands are visibly soiled, then you need to use soap and water again. Also, when performing hand hygiene, it's extremely essential to know that if you are going to use hand sanitizer, that you need to put it on and that you need to consistently keep rubbing it between your hands and that it can't be wet. It has to stay dry. Because if it's wet and you continue to touch platforms and surfaces around the room, you're just pretty much spreading the germs, and it's not going to be as effective. When it comes to the general inspection of your patient, that's going to be when you initially see them and you already start taking in information about them that might be off or wrong, or maybe the chief complaint as to why they're coming in. So you're going to look for the ABCDEEE, which would be the airway, breathing, circulation, disability, EE, and extrinsic factors. So you also want to double check things that might not connect, like maybe misinformation was written down on their chart and you want to verify it, as if, for example, someone on their chart says that they're 58, but you see them and they're clearly in their 20s and the age just doesn't seem to match up. Now, sometimes people look older or younger than what they actually are, but that's always something you want to cross-reference just in case everything was written down wrong. Echoes for their weight, that their posture, if there's just anything else that wasn't noted in those initial paperwork, you want to be looking for that, and that way you can kind of keep an eye on your client, and so you know how they look initially when they walk through the door, and then as you're getting their history, that you start to see if there's any sudden changes, if they're not breathing like they did, if they're really starting to bend over and struggle as if they're in pain and ache, and if they can't really talk. This is also the time when you want to try to catch on to their hygiene and maybe their mood to see if they're really quiet, reserved, if there's signs of depression or anxiety there. Hygiene usually gives hints as to where these patients are living, if they're homeless, or if they maybe are frequent drug users and they are on the streets. It's really important. It's really important that you're alert and oriented. Eye contact is extremely important with your patients, and you need to be looking at them when they answer your questions, and you need to make sure that you're responding appropriately so that way you can get the best information from them, and then when you're engaged with your client, they're more likely to give you more information. So usually on a typical health checklist in the general survey, you want to check their appearance, see what their gender is. Obviously now you need to double check those kind of things. Make sure that they have facial symmetry. If there's signs of stroke, there might be drooping, or if they're slurring their words or on the side of their face, that could be a tell of what they're in there, what their issue is. You also want to check their mental status, see if they're alert, awake, oriented. Check with, ask them if they know what their date is, if they know where they are, why they're there, who they are. Also, their speech, when you're asking them their questions on their health history form, that's when you can check their speech. If their speech was fine when they came in, but it's starting to slur now, that's obviously something that you're going to want to be paying attention and looking at, and maybe that might give an indicator as what they're in there for. Body type's also very big. You could see if they're obese or weight, and that's maybe why they have high blood pressure, or if they're underweight, you could see that there might be some anorexia or bulimic issues. Of course, throughout all of this, and always when you're in your patient and you're in your patient's room, you want to be thinking about the patient's safety. If they're a fall risk, their bed alarm needs to be on. They need to have both sides of their bed rails on just in case they sleep and they roll over. It's just for their general safety. Even maybe if you have to have all 4 of them up, if they are a roll or fall risk, that is necessary. You always want to make sure that room's decluttered. If they do get up and go to the restroom, you don't want them tripping over their shoes or a chair being in their way and it just making it more difficult for them to transition and move around the room. You always want to have their bedside table there because that could be another reason that the patient needs to get up or needs to reach and could be hurting himself after operation. And it's just more convenient and it makes them more comfortable while they're being in the room. Always, always, always give them their call light just in case there's an emergency. The red button is what they use to call you. The rest of the buttons are what they use to operate the TV.